Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's our first webinar for the month of February, and we've got one tonight, and we've got one the next 2 Thursdays in a row. So if you get something out of this tonight, and if you enjoy this, feel free to sign up for the next 2. For those of you that are here for the first time, the way that you can participate is a couple ways. Number one, you can just listen to the answers and the questions that I read and the answers that I give. There's always a lot of learning that takes place with that. The other option is to write a question to me. And the way you can do that is over on the right-hand side of your screen at the bottom. There is a chat box. You can write your question to me through that chat box. Keep in mind that there's a lot of people that show up in these webinars, so I try to get through as many questions as possible, but I may not get through all of them. And rarely I do, but most of the times I don't. If you happen to miss an answer or the question, I am creating a recording of this, and I will send out tonight I'll be editing that recording. Fun way to spend my evening, but I'll do some editing on that. And then I will send out an email notification to you in the morning announcing that it is done, and that will contain the link of where to view it. Now, if you happen to miss that email, because I intended getting this out by around 9:30 in the morning tomorrow, Seattle time. But if you happen to miss that email, you can always find the recordings at treatlyme.net, which is my Lyme disease information site. Treat Lyme by Marty Ross MD, located at treatlyme.net. And on there is a webinars page. And all you need to do is go to that webinars page, and you'll find about a third of the way down, maybe halfway down through the webinars page is an area where you can see all the previous recordings. Okay, so keep that in mind too. During the webinar tonight, I will be reading your questions out loud, but those of you that are participating in this live version will actually be able to see the questions posted on your screen. Unfortunately, the recording mechanism doesn't show them, so I still have to read them so that in the recorded version, people can follow along with what we're doing here, okay? All right. I think that takes care of everything. Let's go ahead and get started here. To those of you that are coming back again, I'm glad to see you here. There are a lot of people that return, and that means you're probably getting some value out of this, so I appreciate that. So let's go ahead and do our first question here. Hello, Isa. Let's see. Chris has been on antimicrobials for Lyme and Bart for years. A year ago, he took nystatin and diflucan to clean up candida in the gut. Chris's GI symptoms didn't improve, and he began getting patches of itchy skin, intermittent oral thrush. Cleaning the skin and applying antifungal cream keeps the itching at bay, but only if he does it twice a day. Chris recently tested positive for gut candida overgrowth through the Great Plains oat test and has almost finished another course of nystatin and diflucan without any improvement. Is it worth refilling the diflucan prescription for another month? Would you still suggest that he try amphoterecin B next? We have shifted to a paleo diet with no grains, starchy vegetables, fruit, and sugars. Is this the right diet for resisting candida? Are mushrooms and fermented products like vinegar, cheese, and tamari okay? All right. So, everyone, let me talk. I'm going to answer that question, but this fits into a bigger question about yeast. All right. So let's talk about that. So it's very possible when somebody has Lyme from having been on antibiotics or because of immune suppression that you can get too many yeast living in the intestines. So your yeast are full of bacteria. Your intestines are full of bacteria and yeast. And if you knock down the good bacteria, yeast can grow too much. And that becomes a problem for a few reasons. One, when you get too many yeast, the immune system see them and react by making a bunch of inflammation chemicals called cytokines. Those cytokines are the same cytokines that get made when your immune system sees Lyme. And in fact, Lyme symptoms are actually too many cytokine symptoms, okay? So if you get too many yeast in your intestines, they can lead to you feeling more tired, having poor thinking, hurting all over, disturbed sleep, etc. All right. The other thing that happens with those yeast is that they release toxins, and those toxins can interact with the skin, leading to a lot of rash situations like you're describing here with Chris, for instance, too. All right. Now, the way to treat yeast is to kill them and then to do things to control them. okay, to not feed them as much, all right? So one thing that can help is to be on a low sugar diet. For people that are having that are new to treating for yeast overgrowth, that have never treated it before, doing things just as simple as avoiding simple sugars in your diet, like cookie, candy, cake, ice cream, that should be enough, okay? But if you get into a situation where yeast is becoming harder to treat, sometimes you've got to get more limited in the sugar supplies that may feed those yeast. And so using a paleo type diet like you described, which is low on carbs of any kind, including beans and legumes, can be a useful way to go. In terms of fermented foods, I don't find those to be a problem when somebody has chronic yeast, and I'm okay with you and Chris actually being on those. So I don't see a problem with that at all. All right. So in terms of how do we diagnose yeast, the most common way is just based on your symptoms. And that is to look and see, is there a lot of sugar cravings, somebody having a lot of gassiness and bloating. Sometimes people feel worse when they have carbs, but to look at what the symptoms tell us. But at times it can get confusing as to whether it's truly yeast that are there or not. So if I treat somebody for yeast based on symptoms and they're not getting better, sometimes I want to do laboratory confirmation of that. And one way that you can, the best way I have found to look at a laboratory confirmation of too many yeast is to do what's known as an a urine organic acid test, also known as an oat test that Issa writes about here, okay? And the oat test looks to see, are there certain organic acids that are made by yeast? And the one that seems to have the best predictive value to tell me if somebody has yeast is a chemical called arabinose. If somebody has marked elevations on the arabinose, and that can be a sign that they have too many yeast in the intestines too. And that's what Issa is talking about here, okay? All right. So then in terms of what do we do to kill the yeast? Well, my favorite treatment is to do a combination of nystatin, which is a prescription, and diflucan, which is also a prescription. That combination works about 90% of the time. 10% of the time it doesn't. And increasingly, unfortunately, we're starting to see resistance developing to the diflucan. So if I've treated somebody once or twice with diflucan and nystatin and they're not getting better, then I'm going to look at other alternatives, all right? And of the other alternatives, the best one that has the greatest likelihood of working is to do a compounded medication, which is called amphoterecin B. Amphoterecin B is a medicine that has to be compounded because it's only manufactured to be given as an IV, but we want to give it orally. And we want to give it orally because in an oral form, it stays in the intestines. It doesn't get absorbed at all. And it works about 95% of the time, but will take a couple months. And it's not an inexpensive option. In fact, it can cost here in the US, the compounding pharmacy I use, for a 2-month supply of it, it's going to run about $360 at US, okay? In Canada, it can be much more expensive, unfortunately. But it does work about 95% of the time. It can take 2 months. Now, other alternatives to doing that, if somebody fails a nystatin diflucan treatment, one other option would be to do another member of the same anti-yeast family that diflucan is in, which is a drug called itraconazole. And itraconazole will work about 80% of the time when diflucan, which is called fluconazole, does not work. There's also herbal options you can look at. You can do herbal combinations with things that have herbs in them that kill yeast, and such things could be powder coke, caprylic acid, rosemary oil, thyme oil, odylsinic acid, all kinds of things that you can put together that potentially could kill yeast. They generally work about 80% of the time, but take about 2 months, okay? So if you're looking for the best way to go at this, Issa, it would be to do the amphoterecin, actually, okay? All right. So let me show you, I'm going to do a quick screen share here. All right. Oops, I was doing a screen share. Let me try that again. There we are. Okay, so this is my Lyme disease information site, which is called Treat Lyme by Marty Ross MD. I have in my online Lyme guide where I've got lots of information. If you think you have a question about Lyme, look here first to see what I've written about it. I've written a lot of things about different approaches to managing Lyme and the problems of Lyme, okay? But I have a section on yeast. And in terms of figuring out if you have yeast, there's an article here that kind of primarily looks at what the symptoms are, okay? I should update that to include the arabinose information. I haven't done that. But anyhow, in terms of symptoms that make you think about yeast and a screening tool that you could use, take a look at this article. In terms of approaches to get rid of those yeast, take a look at this article here where I outlined the various methods that I was just telling you about, okay? All right. Thanks for that question, and good luck to Chris. Hello, Erica. Let's see. I currently have Lyme and Babesia, as well as a fungal and staph infection in my nose due to mold. I recently had blood work and my immunoglobulin IgA came back low. Have all of my infections caused the IgA to be low, or has my low IgA caused me to be more susceptible to these infections, or to make it harder to get rid of the Lyme Babesia mold infections? Also, am I more at risk of getting a more serious life-threatening cause of COVID as a result of the low IgA? So, all right, let me try to answer that as best as I can. So, IgA, everyone, is a type of antibody called IgA antibodies, okay? All right, so so antibodies, as many of you know, are proteins that are made by the immune system that can attach to a germ. And once they're attached to a germ, other parts of the immune system will come in and get that germ. All right. The most common antibodies that we have that fight infections are ones that are called IgM and IgG antibodies. And these are antibodies that circulate in our blood to fight infections. IgMs are what we first develop whenever we have an infection, and they eventually get replaced by IgGs. All right. Now, our mucous membranes, like our nose passages, our air pipes, our intestinal tract, have another type of antibody that can line them called IgA antibodies, okay? And IgA antibodies kind of keep things out that shouldn't be there. Our body develops IgAs after it's first been exposed to something. So, because most of us have never seen COVID-19 infection, we would ordinarily not be making IgA antibodies. We wouldn't have them. We don't have that as a protective mechanism, okay? So in terms of, does an IgA, if they're low, make you more susceptible to COVID-19? Not necessarily, because none of us have IgA antibodies against COVID-19 because we've never seen this type of an infection before, okay? All right. In terms of, does it make it harder for you to get rid of any infection in general? Probably not, because the IgAs only protect us from things getting in. It is our IgMs and IgG antibodies that actually do the work once something gets inside of us. And I would suspect your doctors probably, if they were checking for IgAs, probably were looking at your IgG antibody levels as well too. And hopefully those were fine, okay? All right. In terms of, I want to just clarify something because, so you mentioned that you have a fungal and staph infection in your nose due to mold. I want to just tell you it's not due to mold. And I want to clarify that whole situation for you. So there is a physician named Dr. Richie Shoemaker, who's the physician that first came up with a theory about mold and mold toxicity, and the fact that he was the first person to show that 25% of people, when we live in mold environments, if we breathe in those mold toxins, 25% of us can't get rid of them, okay? And Dr. Shoemaker came up with an elaborate theory that said, here's how you can get rid of those mold toxins. And he also came up with a theory that looked at a bunch of blood testing you could do to see if you have inflammation chemicals that are elevated due to having those mold toxins. Now, in his theory, he contends that if you get mold in you and you remove those mold toxins and you don't get better, it must mean that either there's something else triggering the inflammation, or that the inflammation has kind of been set on autopilot and it just takes off and goes off on its own. Okay. And so part of his theory is if you've got mold toxins and you remove those mold toxins, you're not getting better, then he says you should look to see if you might also have another type of infection in your nose that could be stimulating inflammation in your body. And that's an infection called MARCONS. Okay. The mold didn't cause it to be there. In fact, MARCONS is a common bacteria. All right. So, and then he postulates that you need to kill the MARCONS because that's a source of inflammation. But Dr. Shoemaker and all those Shoemakerites that are out there are wrong. They're wrong. Here's what the issue is. Dr. Shoemaker doesn't believe in Lyme disease, and he misses a big problem. And that is people have another major reason that people have a lot of inflammation in their body could also be due to having chronic Lyme infection. And chronic Lyme infection gives you the same type of inflammation and causes the same type of inflammation markers that he is testing for mold. They're actually elevated because of Lyme too. So he misses the point. Secondly, MARCONS, this bacteria, this staph infection you're talking about, is actually, I think, common even in healthy people. And just finding it there does not mean it's causing a problem. I will tell you in my Lyme patients, when I used to test for it, I would find it. And I would have people take antibiotics and antibiotic nose sprays to get rid of it. And sometimes we'd get rid of it, and it never made a difference. It doesn't actually make a difference. In addition, even if you get rid of it, it's going to come back. It's practically impossible to get rid of it. So I know there's a lot of doctors out there that have been trained by Shoemaker, but they don't necessarily understand Lyme, number one. And also even Shoemaker these days will notes that the MARCONS is practically impossible to get rid of. So I don't think it's a real problem. I don't think you can get rid of it even if it's there. It's not caused by mold. It just happens to be there. And Dr. Shoemaker found it. So he started thinking, well, maybe this is the problem when people don't get better by moving their mold toxins. But I think he's wrong. I think what the major issue is for a lot of these people is that they actually have Lyme. Okay. So I want to let you know there's two different schools of thought now about mold toxicity out there. Shoemaker is kind of the old idea, the old school. He still trains a lot of people. A lot of people are trained in his old school methods. But there's a newer group of us that believes that, first of all, you can't rely on those inflammation markers. Most of us actually now, to see if somebody's getting better from mold toxicity, do urine testing to see if the mold toxins are in them, which is probably a more accurate way of seeing if they're in you rather than doing all the inflammatory testing. And we follow those. And we follow those as a means of indicating if somebody's going to get better. And most of us also acknowledge that other things that can cause those those elevations in the inflammatory markers like TGF beta 1 and VEGF and MM9 that all those Shoemaker testers like to do, we recognize that there are other things that elevate them besides mold toxins as well too. Okay. All right. So anyhow, Erica, those are my thoughts on it for you. Okay. All right. Let's see. In terms of will having low IgA make it harder to get rid of Lyme, Babesia, and mold? No. I think that you still have probably functioning IGM and IGGs as well too. Okay. All right. Good luck to you. Hello, Kelly. Let's see. Hello, and thank you for all that you do. Wondering if Botox would affect Lyme or mold. Thank you. So I have so Botox, everyone, is the toxin made from botulinum toxin. All right, and it can be used for a number of reasons. One, it's used cosmetically. I mean, you can inject it into the crow's feet around your eyes, your laugh lines if you want to. And what it does is it paralyzes the muscles that make those lines stay in place, okay? But it stays right there, all right? The other reason it can be used is it's been found to be helpful to do injections for people that keep getting repeated migraine headaches. It can be very useful at breaking those and preventing those too. In my experience, as I have seen people use it for migraines, and I have seen people in my practice use it cosmetically, I have found that it doesn't do anything to hurt Lyme or mold toxicity illness. Okay, so I think they're safe to use actually. In fact, for some of my patients, the big thing that actually has finally given them some relief from their migraine headaches as well too. When nothing else I might try works for them. Okay, all right. Thanks for the question, Kelly. Good luck to you. Hello, Leslie. Hold on here just a minute. I'm going to have a sip of coffee here. All right, let's see. I have an Elispot Lyme test that was positive from several years ago. Then an Armin Elispot that said I have weak current cellular activity against Borrelia 2 years ago. And I had bloods to check cross-contamination and there was none. My only symptom is chronic bladder pain, which I've had for 8 years. Would you treat for Lyme? Based on what you just said here, probably not. But let me try to answer that a little bit more. All right, so the Elispot and the Armin Elispot basically are the same type of test. They're known as Elispot tests. Even the Elispot is an Elispot test. And what we do in an Elispot test is we're looking to see, do your T white blood cells, the type of white blood cells that actually fight a germ, have they been exposed to Lyme? Have they seen Lyme at some time? Okay. And so the way the test is done is we draw your blood, we take your T white blood cells, we put them in a test tube, and we add proteins that are Lyme proteins into that test tube. And if those T white blood cells have tried to fight Lyme before, they're going to react against those Lyme proteins and they're going to manufacture a group of chemicals called cytokines, and we measure some of those. And we find the test is positive if you have an elevation in those cytokines, okay? All right, that's how it's done. Now, the problem with Elispot testing, whether it's the Elispot test or the Armin method of doing the Elispot, is they're wrong 15% of the time, okay? So just having a positive Elispot test does not, in other words, you can have a false positive, I guess is what I'm trying to say. And so when we're looking at the accuracy of an Elispot test or any kind of a Lyme test, even the immunoblot or the Western blot testing we're doing, a test is only a test ability to predict that you truly have a problem is only as good as the symptoms that you have. In other words, if you have more symptoms of a type of illness, then the chances that the test is correct goes up. If you only have one symptom of an illness that tends to have many, many illnesses, the chances that that test is a false positive goes up. Okay? All right. So bladder pain in and of itself is not enough to say that somebody has Lyme disease. I usually want to make sure that somebody has a lot more symptoms that we might have. And if the only symptom you have from what you're telling me is bladder pain, it could be that the Elispot was a false positive test. All right. Now, there's some other things you could do to look at this, and I'd be glad to help do that with you. I would actually want to take my own detailed history from you to find out, is there anything else here that suggests Lyme? Is there anything else here that might even suggest Bartonella? Because Bartonella sometimes can give bladder pain too. But based on what you've told me here, that does not prove you have Lyme, okay? Because it could be a wrong test. And if you don't have any other symptoms, you got to we have to ask the question, could the test have been wrong, okay? All right, Leslie, if you are interested in getting my input, let me show you how you would do that. And do a quick screen share here again. All right, so in terms of getting some advice from me, you could click on my clinic link up here on my Treat Lyme by Marty Ross MD site. And this will bring you over to my website, my practice website, which is Marty Ross MD Healing Arts. Take a look at my appointments page. And I'm doing telemedicine visits right now. And I have two types. I have something called a full medical service and a limited consult service. The difference is in my full medical service, I can prescribe and I can order tests for you. And then the limited consult service visit, I can only give you advice. And also with the full medical service, you agree that at some time, once we don't have a lot of COVID out there anymore, you will fly out to see me here in Seattle. and I will do one of our follow-up visits as an in-person visit, okay? All right. You can read down here more about the details and what you can expect and forms you need to fill out beforehand, at least 2 business days before, down here. And if this is something you might want to do, take a look. You can book the appointment now by clicking my Book Now button, okay? All right. All right, Leslie, good luck to you. Hello, Kelly. Hello, Dr. Ross. Do you follow the Shoemaker protocol here? And is there more and better treatments out now for mold? So, Kelly, I think I answered that earlier. I don't follow Shoemaker. I think he was great at pioneering the concept and showing us that genetically 25% of people are programmed in a way they can't get rid of mold toxins. But the world has moved beyond Dr. Shoemaker, and he still is holding on to his old ideas. And unfortunately, a lot of practitioners out there are holding on to his ideas. Shoemaker doesn't believe in doing urine mold testing, which I think is a more accurate way of telling if mold toxins are in you. And Shoemaker is not as up to speed on the different kind of mold toxin binders you can use to remove those. He primarily uses just cholestyramine or Welchol. There's actually other things you can do. So the world has moved beyond Dr. Shoemaker. And so for information about how I manage mold toxins, which is similar to a lot of us, I'll show you an article here which talks about the urine testing and the different mold toxin binders you use depending on what that urine testing shows us, okay? All right, let me just go ahead and show that to you here. All right, so for a better way of managing mold toxin illness, you can find that information in my detoxification section here. And my article on mold toxin illness is right here. Okay? And I talk about how to diagnose and what are the best binders to use in terms of treating as well too in this article. Okay. All right. Good luck to you, Kelly. Hello, Andrea. Let's see. Can neurological Lyme cause cervical dystonia? Since I started being treated with antibiotics, my neck is pulling and shaking. Okay. So dystonia means that the muscles up here in the neck are being pulled one direction. And that is can be triggered by the nerves causing those muscles to fire. Okay. All right. So what could cause that? Well, Lyme and Bartonella could both cause that. But if it didn't start until you started using antibiotics, I would also wonder, are you having a side effect of one of the antibiotics? And so you might want to talk to your practitioner about that. And the way to see if it is due to one of the antibiotics is stop them and then add one back in and see how you tolerate that. If you tolerate that one, fine, then go ahead and do the other one. But don't stop anything without talking to your doctor first, okay? You need to make them aware of what you're doing. So I want to be clear about that. I'm not telling you to stop without getting input, but the dystonia might be a side effect of one of your antibiotics actually too, okay? All right. Good luck to you, Andrew. Hello, Robert. Let's see. Hi, Dr. Ross. Thanks for your help. You're welcome. Do you ever use Biocidin as a single antimicrobial at the beginning of treatment? What's the most effective painkiller for Lyme, severe sharp pain, nerve pain? Is gabapentin effective for this? I'm looking to replace ibuprofen. All right. So a couple things. Number one, so Robert's asking me about an herbal option to treat for Lyme. So in terms of herbal options, my favorite herbal option to kill Lyme that I find to work as effectively as prescription antibiotics is a combination of cat's claw and otoba bark. I find those to work best, okay? I'll show you an article about that here in a minute. There's Petri dish experiments that show that they do a good job of killing both forms of the Lyme germ. And there's Petri dish experiments that also show that they remove 100% of biofilm. Clinically, I find those two herbs in combination together work effectively 85 to 90% of the time, okay? All right, my next option would be to try Biocidin by itself. And if you were to do this Biocidin, I would get the form called Biocidin LSF, which is a liposomal variety, which increases the absorption of the product into your blood. Okay. Now, Biocidin has about 10 different herbs in it, so it has a number of antimicrobials in it. And there's research on it that shows that it does a great job of breaking down biofilms, and it can kill Lyme and cyst Lyme as well too. My experience working with it finds it is helpful about 75 to 80% of the time as the main thing you would use. And so if you're using it by itself, I give it about a 5% less chance than I give an otoba and cat's claw of working. Okay, but it could work. It could work. Let's see. What is the effective painkiller for Lyme? Oh, and if you're going to do Biocidin LSF, do it as 2 pumps 3 times a day is how I would dose that. Okay. All right. All right. Let's see. What's the most effective painkiller for Lyme severe sharp nerve pain? All right. So nerve pain, just so you know, what is nerve pain? Well, muscle pain and inflammation, joint pain usually is achy, the quality of achiness. Okay. Nerve pain usually has qualities of sharp, stabbing, shooting, burning, piercing, and electric. That's nerve pain. And things that can be useful for that herbally, you could use a product called L-theanine. L-theanine is a component of green tea, and it is converted into the chemical called GABA. And our brain has a bunch of receptors known as GABA receptors. And if you block a GABA receptor, you can decrease neurologic transmission of pain. So L-theanine, you can do it anywhere from 200 to 600 milligrams a day, one time a day, can sometimes help. I usually have people take it at nighttime because it can make you sleepy. Another alternative for nerve pain would be to actually do more neurologic modulation of that pain. And you could use anti-seizure medicines. Gabapentin is one of those. Lyrica is another one. Something called Gabatril is one. Those can sometimes help. Other options to decrease nerve pain are to use what are known as tricyclic antidepressant medicines like imipramine, desipramine, nortriptyline, amitriptyline. Those can sometimes make a difference as well too. Okay. All right. So those are some thoughts for you. All right. I'm going to do a quick screen share and show everyone some resources here. Thanks, Robert. All right, so for ideas on how to manage pain, take a look at this article here called Stop Lyme Pain, okay? And this gives you ideas on how to manage both inflammation and nerve pain. I talk about the nerve pain strategy here. One other thing I would talk about nerve pain to think about is CBD oil, as in medical marijuana can be helpful. You can also use low-dose naltrexone can sometimes be useful as well too, okay? So take a look at this article for ways that you might manage nerve pain. In terms of the marijuana and the thoughts I have on that, the whole article I have about that here as well too, okay? All right. Then in terms of the otoba and cat's claw that I was talking about, take a look at this section here called Anti-Germs, the Prescriptions and Herbs. And there's a whole article I have about both the otoba bark and cat's claw. And I have an article about the Biocidin. Okay. All right. So you can take a look at both of those here in terms of comparing those herbal options as well too. Okay. All right. Thank you, Robert. Good luck to you. Hello, Kelly again. Let's see. I know people flare with Lyme symptoms when on their cycle, but does that happen for mold as well? You know, sometimes I will see it. I have seen that happen. So yes, it is possible to answer your question. Hello, Sandra. Which tick illness causes balance problems, spastic gait, neuropathy, and head pressure, right? So the two primary ones that I would think of that could do that are either Lyme, the Lyme Borrelia infection, Borrelia, which is also known as the Lyme germ, okay? Or Bartonella sometimes can give symptoms like that as well too. Bartonella is known for giving a lot of neuro and psych symptoms, so bad depression, bad anxiety, and also neurologic conditions. Sometimes some of the worst neurologic conditions we'll see when Bartonella is involved, okay? All right. Thanks for the question. Good luck to you, Sandra. Hello, Sherry. Let's see. Hi, Dr. Ross. What do you think of treating mold with alpha-lipoic acid and phosphatidylcholine? Is nystatin effective in treating mold? Many thanks for all you do, Sherry. So, okay. So with mold, I want to just address one thing. So actually, let me talk about mold in general. All right. So mold in your environment can cause two problems for you. Number one, some of us are allergic to mold. All right. So if we walk into a building with mold, our allergic cells will see that mold, and we might start releasing a lot of histamines, and we'll have coughing and headaches and breathing problems, for instance. Okay. All right. Usually that kind of a situation where you're allergic, the minute you leave that environment, you start feeling better. The other thing that can happen with mold is you could have a person that gets mold toxic, meaning they breathe in a mold toxin, it gets in their bloodstream, and if they're one of the 25% of people that are genetically predisposed, their immune system doesn't get rid of those mold toxins and they build up in you. Okay. All right. All right. So I just want to say that. Okay. Now, when people have mold toxicity, occasionally, when they've been in these moldy environments, they may also pick up some of the mold spores, and the mold starts living in them, and they become colonized with mold. Okay, they can become colonized up here. They can become colonized in their intestinal tract. And if you get colonized, the mold can start producing its own toxins, and you become your own mold toxin brew pub. Okay, all right. Now, there's different things we can use to kill the mold that is living in you if it's there. Most people don't have it. Most of us, are not colonized. But if you happen to be somebody that is colonized, the way you get rid of the mold, you got to stop producing your mold toxins. Okay, so you got to kill your mold. Nystatin is something we can use either as a nose spray or we can use it as a pill. If we use it as a pill, it's only going to treat intestinal fungus. It's not going to do anything for fungus that's up here. To get up here, you can do it as a nose spray. The reason it doesn't get up here is in the intestines, it's actually not absorbed into the blood. So it doesn't have any way of getting into the blood and then working back to the sinuses, for instance. Okay. I think there are better mold killers than nystatin, but to answer your question, yeah, it could be used to treat it. I think itraconazole is stronger. I think amphoterecin is stronger, but nystatin could be used. Okay. And then in terms of the phosphatidylcholine, so phosphatidylcholine isn't going to do anything to either kill mold, nor is it going to do anything to remove those mold toxins from you, nor is it going to do anything to block the allergic reaction to mold. What it can do, though, phosphatidylcholine is something that can be used to repair the covering of your mitochondria membranes. Mitochondria are your cell energy factories, and sometimes the cell energy factories can be damaged because of mold toxins, and so sometimes phosphatidylcholine can be used to do that repair. Alpha-lipoic acid is used in the body is turned in and supports the production of glutathione. Glutathione is used by the liver to help detox, and glutathione also is used to repair damage to injured cells. So alpha-lipoic acid isn't going to kill mold, isn't going to remove mold toxins, but it may help repair some of the injury in the body from having had mold toxins in you. Okay? All right. Good luck, Sherry. Okay. Kelly, I'm going to take one more and then I'm going to stop taking your questions because I want to make sure that I have time to answer everyone else's questions too. Okay. How long does it typically take to get mold out of one's body? So typically it's going to be anywhere from about 3 to 6 months. That's on average. Okay. And the way that you know you're getting it out is you periodically go back and redo your urine test and see their numbers are changing, and you look at what the symptoms tell you too. Okay. All right. Good luck to you, Kelly. Hello, Cindy. You're welcome, by the way. Hold on here just a minute. All right, let's see. Thank you so much for providing this forum. You're welcome. Is a high C-reactive protein in a blood test in a teenager related to Lyme? How should it be treated? So C-reactive protein is a chemical that can be elevated with certain kinds of inflammation. It is not always universally elevated when somebody has Lyme. In fact, people with Lyme can have tons of inflammation that you can see on exam. They feel the inflammation and the pain, and they can have totally normal C-reactive proteins. In fact, the majority of the time they have normal C-reactive proteins. So C-reactive proteins do not accurately pick up all kinds of inflammation, but they can pick up some kinds of inflammation, all right? So what do you do for C-reactive protein? Well, ultimately, to lower it, you got to get your source of inflammation under control. And if it happens to be Lyme causing it, you treat the Lyme, basically. There isn't something I have people take directly other than getting the infections under control to get the C-reactive protein down, okay? All right. Good luck to you, Cindy. Good luck to your son. Hello, Sharon. Let's see. Hi, thank you for any help. In 2019, IGM positive IGenics, 2020 IGM and CDC positive, IgG always negative. Does IGM sometimes not convert to IgG? I have positive Epstein-Barr virus, very fatigued and brain fog. Can EBV cross-react with Lyme and IGenics? I had a bite several years ago with a bullseye rash, but no one knew what it was. Okay. So let me try to answer all that for you, Sharon. Yes, I can help you look at that. Okay, so whenever somebody first gets sick with any kind of an infection, the first family of antibodies to develop are IgM. Okay, and IgM are considered to be the acute antibodies. They are supposed to go away in infections by 6 weeks to 3 months on average, and then they get replaced by IgG. The immune system starts making IgG. Once your immune system makes IgG antibodies, they are the memory of the immune system. And finding an IgG does not tell you if the germ is still in you. It could be, but the best it tells us is that an infection has been in you before, okay? And then we have to look at your symptoms and say, are there enough symptoms that say it could still be there? And if you do, then we treat, okay? Now, there is a strange thing that happens with Lyme disease for which we do not have a good explanation. And that is, it appears about 50% of the time that somebody has Lyme disease, they do not convert from making IgMs to making IgGs. It's 50% of the time, okay? All right, so the issue with that is a lot of times the infectious disease doctors will look at those IgMs, and if you've been sick for years, they're going to call them a false positive test. But the reality is, and this is based upon NIH studies that were done looking at whether long-term antibiotic treatment would work. One of the other findings we had from those studies is about 50% of the people in those studies that had chronic Lyme had IgMs that were positive. They tested positive for IgMs, okay? So I just want to let you know it's not a false positive. We don't have a good explanation for why it happens, but it is true. Some people do not convert to making the IgGs, okay? All right, now, in Lyme testing, when we do Western blot testing, the technique called a Western blot is the method that is used by the FDA-approved labs or lab test kits. So your LabCorp and your Quest Diagnostics are going to do Lyme testing using a Western blot kit that's approved by the FDA, okay? And what happens in a Western blot is we're looking to see, does your immune system make antibodies that attach to proteins found on the covering of the Lyme germ? And specifically, the way that that test is done is we grow Lyme germs in the lab, we kill them, we take their proteins, and then we put them on a test strip. We run electricity through the test strip, and that moves the proteins that weigh different weights to the same place. So all the proteins that weigh 41 kilodaltons or 23 kilodaltons or 39 kilodaltons all fall to the same place, okay? We call those bands. And in fact, on the Western blot, you'll see they report out band 39, band 41. Those are all the proteins that weigh 41 or 39 kilodaltons, okay? All right. And then what we do then is we then take antibodies from your blood and we place them on the test strip and we see, do they attach to those proteins? And if they do, we call that positive. All right, that's how the technique is done. The problem is that certain virus infections like cytomegalovirus, like human herpes virus type 6, and like Epstein-Barr virus, when we have those infections in us, sometimes the antibodies we make against them cross-react with our Lyme proteins. They will attach to our Lyme proteins, all right? In which case they can give a false positive test. The best way to avoid that type of false positive test is to do the newer test that has been created by IGM, which is a test called an immunoblot. And that test is better than the old Western blot for a couple reasons. Number one, the immunoblot is looking to see if your immune system is making antibodies against 8 different kinds of Lyme germs. The original Western blot that is still done by using FDA-approved test kits looks to see if you have antibodies against 1 kind of Lyme germ. And in fact, it's the original kind of Lyme germ that was discovered back in the 70s. I mean, this is out-of-date testing, okay? Yet it's still the testing that the majority of doctors use, okay? So the immunoblot looks to see if you have antibodies against 8 kinds of Lyme germs, and the Western blot that's done using an FDA-approved kit looks to see if we have 1. IGM also has a Western blot, and their Western blot is still better than the FDA-approved kit because it's looking to see if you have antibodies against 2 kinds, all right? But they now are testing to see if you have them against 8 kinds, all right? Now, in the immunoblot that IGM is doing, there's another thing that makes it better, and that is what they've done is they've taken these proteins from these 8 kinds of Lyme germs, and they have genetically modified those proteins to remove parts of those proteins that would attract antibodies made against cytomegalovirus and Epstein-Barr virus and human herpes virus type 6, okay? They've removed the chance of having a false positive. That's what makes that test better, okay? So the IGM immunoblot, based on their validation studies, can find Lyme when it's in you about 95% of the time, which compares to the FDA-approved type of test kit, which can only find Lyme if it's in you about 65% of the time, okay? And because they're using these genetically modified proteins to do the test, the Lyme immunoblot does not have any false positives, okay? All right. Thanks, Sharon, for that question. And I think that gives you, I hope that answers it for you. All right. Good luck to you. Hello, Crystal. Let's see. If someone has been diagnosed with late-stage Lyme and a lot of memory problems, will their memory improve with treatment? What meds or supplements work best with a delicate system? So, Crystal, I can't answer that last question because I need to know more about what delicate system is in you. Everybody has different degrees of being delicate, and it all depends on what's going on with you. So I'm sorry, I'm not going to be able to answer that. If you do want some direct input, take a look. Earlier tonight, I showed everyone how to consult with me doing telemedicine. I'd be glad to help you look at that. And there's 2 different ways you can do that. You can click on the clinic link and then go to my appointments page. So go to my Lyme disease information site at treatlyme.net. On the upper, very top navigation menu, there's a link that says clinic. Click on that, and then click on the appointments page, and you can read about 2 ways that you could visit with me so I can help you consider what to do in terms of medicines based upon your type of sensitivities, okay? All right. But in terms of can your memory get better? Yeah. Treating the Lyme, getting the infection down can make a big difference. And sometimes if treating the infection alone by about 6 to 9 months does not help the memory too much, then I will start to do some specific repair work to help the memory get better too. So one of the things that can happen when you have Lyme infection in you is the immune system, in trying to get rid of the infection, will overproduce a group of chemicals called oxidizing agents, okay? And oxidizing agents can damage the covering of your nerve cell membranes and can also damage the covering of your mitochondria, all right? Now, mitochondria are your cell energy factories, and if they get injured, they're not going to generate enough energy to help you heal, and they're not going to generate enough energy for your nerves to function, for you to think, okay? So keep in mind, all of you out there that are, I know a lot of my colleagues have been starting to offer ozone and IV hydrogen peroxide, and they bought all this fancy equipment, so now they're pushing their ozone and their IV hydrogen peroxide. Keep in mind, those are oxidizing agents, all right? So they may be causing more injury than they're doing benefit. One other comment about those forms of oxidation too is even though they might promote them as killing germs, they probably don't. There's good studies that show that if you put germs in a test tube and you put 1 drop of blood in there, and then you add ozone, there's no killing that happens at all. And so, and probably the reason for that is your blood's full of antioxidants that can make it so that ozone can't kill. Okay. Anyhow, that's commentary. I'm kind of, I'm at a little bit of a loss as to why my colleagues are doing these types of treatments in people to kill germs when the lab evidence says it doesn't. Now, I will also admit that with oxidizing medicines like ozone and peroxide, you might feel better, but that's because it results in some improved oxygen going to the mitochondria. Long term, though, I think there's more injury that happens from it. Okay, but back to your question. So the one of the things that happens when you have chronic infection, these oxidizing agents, is you do get injury to the nerve cell membrane and you do get injury to the mitochondria, okay? And so sometimes just getting the infection under control by using antimicrobials for about 6 months will be enough for repair and recovery to start happening. But sometimes we have to get in there and fix the mitochondria and fix the nerve cell membranes. And so what we can do for that is, one of the products I like using to repair the nerve cell membrane and mitochondrial membrane is a product by Research Nutritionals called ATP 360. Take 3 pills 1 time a day. In addition, I also like to have people take glutathione. Glutathione is the master antioxidant that is made in every one of our cells, and it helps repair injury. But if your cells are injured, sometimes they exhaust their fuel supply, if you will, and they can't make enough of it, all right? So glutathione can be helpful too. And for that, I like using a liposomal variety of glutathione. And a product I like for that is a product made by Research Nutritionals called Trifortify Orange or Trifortify Watermelon. Do 1 teaspoon 1 time a day. So my program to help improve thinking says get germs out. And then it also says fix your mitochondria and nerve cell membranes. Okay, all right. I'm going to show you an article that you can look at about that. All right, so let's see here. All right, so take a look at my brain and nerves chapter and take a look at this article. Which one do I want to do? Take a look at this one called Brain Fog in Lyme, not brain frog, brain fog in Lyme disease. You can fix it, okay? And I talk about what to do. I talk about in here about, if you have mold toxicity, get rid of it. If you have infections, deal with them. Number 2, fix your mitochondria. And I talk about how to go about doing that here. Okay. All right. All right. Oh, one more thing. So for more detail about my feelings and the science behind why I don't advocate ozone and hydrogen peroxide, take a look at my article on ozone. And if you want to find the reference that I talk about that shows that this stuff is not a good killing agent, I have a list of references down here below as well too. Okay. All right. Thanks for the question, Crystal. Good luck to you. Hello, Ruth. All right, so Ruth, let's see. You mentioned a few weeks back that disulfiram is fat soluble and putting it into olive oil may help with diarrhea. I have tablets, not capsules. Would crushing it work? Also, would putting the pills into enteric coating also work? So what I can reflect is I have a patient of mine that had gotten bad diarrhea on the disulfiram, and what we wound up finding that worked for her, I know that disulfiram is fat soluble, so I started thinking about this, and I thought, I wonder if we need to increase its absorption so there's less left in the intestines to irritate her intestines, leading to diarrhea. Okay, and so what we wound up doing with hers is I had her crush her tablets and then and put it in a little bit of olive oil and take it that way, and that has worked to get rid of her diarrhea. Okay, so I think it has helped increase the absorption of the disulfiram, and so that's what's proved successful for her. I don't know the answer to your second part of your question as to whether putting it in enteric-coated capsules will make a difference or not. I haven't tried it that way before. I'm not sure it would, because the enteric-coated capsules, all that's going to do is give better delivery of the disulfiram into the intestines. But once it gets there, I don't think they're going to increase the absorption of it, okay? Versus, I think mixing it in oil, as I've suggested, is probably a better way of increasing the absorption of the disulfiram too, okay? All right. Thanks for that question, Ruth. Hello, Sandra. Let's see. How do you test and treat for neurological Lyme? Thank you. So neurologic Lyme can mean many different things to different people, okay? So probably everyone that has Lyme has a degree of neurologic Lyme. In fact, there's good studies that show within hours of Lyme getting in you, it has crossed over into the brain, all right? So everyone has neurologic Lyme to various degrees, all right? So neurologic Lyme can mean things like, I can't think straight. And practically everyone with Lyme cannot think straight, okay? But neurologic Lyme can also mean some other things like having bad seizures or having stroke-like symptoms or having severe numbness and or loss of the ability to use an arm or a leg. Okay, that's bad neurologic Lyme, all right? So for most people's neurologic Lyme, just using oral antibiotics will take care of it. You often do not need to go to IV antibiotics. Just being on oral antibiotics and killing your germs, and yes, most of them actually can get into the brain to some degree. That's the best way to treat. Okay. At times, if doing oral antibiotics does not help get rid of some of the neurologic symptoms, then sometimes we have to go to injectable antibiotics like IV antibiotics or butt muscle injections. Okay. But I want to let you know, just because you have neurologic symptoms does not mean you necessarily need to do IV antibiotics. My experience says about 85 to 90% of the time, neurologic symptoms of Lyme will respond and get better on oral antibiotics. Okay, just want you to know that, okay? The other things to do with neurologic Lyme, I had just showed you that article about brain fog and doing mitochondrial repair and nerve repair. Follow the guidelines that I have there. So I just talked about that in one or two questions ago as well too, okay? All right, thanks for that question, Sandra. Hello, Geraldine. Let's see. would COVID vaccines with adjuvant be more of a problem for Lyme patient than ones without it? I'm sorry, Geraldine, I don't know what you mean by adjuvant. I'm perplexed by your question. I can't answer you. Sorry about that. Hello, Kaylee. Let's see. Hi, Dr. Ross. What do you think of Lyme mold treatment centers? Are there any you recommend? What are your thoughts on the Spinagle Treatment Clinic in Florida? Many thanks. All right. So I would probably stay away from them, just to be quite candid with you. So the main two would be the Spinagle Clinic, and the other one would be the Envita Clinic down in Arizona. These are clinics that have done a lot of investments in their IV therapies and in their hydrogen peroxides, and I think maybe even their ozone treatments as well too. And they're very invested in those. What I will tell you is you can get better by doing oral regimens and staying away from doing ozone and hydrogen peroxide. These centers generally have a lot of treatment failures, has been my experience, because I have to pick up the mess they create often. And so I'm not big supporters of them. They charge a heck of a lot of money with the idea that they somehow miraculously can give quick turnarounds by doing all their IV supports and their IV ozones and hydrogen peroxides and their IV antibiotics. The reality is nothing is quick in this illness. It takes time. And it takes time of just staying with your treatment. And it takes time working with one provider and working with somebody that can't, that is willing to stick with you and do the antimicrobials, basically. Okay, so I'd be careful. They charge a lot, and I'm not that impressed with the outcomes, to be honest with you. All right, thanks for that question, Kaylee. So I guess what I want to say to everybody here, there are no quick fixes in this illness. I know I've got a lot of people that have spent quite a bit of money going to Germany, for instance, to do the hyperthermia treatments there, where they get also IV hydrogen peroxide, and sometimes they also get IV antibiotics. And I have a lot of people coming back from there that do well for a month or two, and then we need to start treating them again because those treatments don't give long-lasting results. And they spent a truckload of money getting there and a truckload of money in those clinics. Same with Spinagle's clinic, and same with Envita down in Arizona. I'm just really skeptical of those, okay? Anyone that's offering you a quick fix in this illness, run the other direction. That also relates to the new SOT treatment that is being advocated by a clinic in Georgia. There is no science at all that supports the use of that. And although there may be some people that report improvements, the majority of people are not getting improvements from what I can see from up here, okay? There are no quick fixes in this illness, unfortunately. Let me just do a quick screen share because many of you may be wondering, what am I talking about with the SOT treatment? So here's my article on the SOT treatment for Lyme disease. In this type of treatment, basically, supposedly, and I use the word supposedly, you're being injected with something called nucleotides that program your cells to stop producing Lyme. That's kind of a simplified way of saying it. The trouble is we have no idea in what these clinics are using actually when they get the substance. Is it still active? And there's been no studies ever done showing that this works for Lyme. Okay, so I would be very skeptical of this one too. Hello, William. Let's see. I finished my Lyme treatment about a year ago and had been feeling great. Recently, out of nowhere, I feel sick again, muscle weakness, fatigue, headaches, dizziness, the whole thing all over again. Is this common with Lyme patients to have all symptoms come back like this? So, William, one thing I want to let you know, many of us that treat Lyme disease would consider somebody to be cured if they have no relapse in their symptoms for at least 2 years. All right. So what that means is that some people can relapse, unfortunately. So when we're done treating, sometimes the germ still remains in you and it's just kept in check by the immune system, for instance. And periodically it might get more active. However, before you start running around thinking it's reactivated, I want to throw one other idea out at you. So in my experience, when I get somebody into remission or I get them cured, it seems like they're cured, they're doing well. And then a year or 2 years later, they come back and they're not doing well anymore. If I take a very careful history from them, about 80 to 90% of the time, I find that the reason they're not doing well is that they've developed too many yeast in their intestines. And it can look exactly like a return of Lyme, Bartonella, Babesia. It can look like all of those, okay? So how can that be? Well, first of all, from having been on antibiotics, either herbal or prescriptions, you are going to be a setup to get too many yeast start growing in your intestines for years down the road, okay? There's no way around it because you used antimicrobials and we have to. That means that knock down good bacteria and there's going to be a disruption of that good bacteria in your intestines for years, which is sets up the stage so that yeast can start growing too much in your intestines, all right? So how does too many yeast relate to return of all your Lyme symptoms, all right? So here's what the issue is. When you have Lyme in you, the predominant reason you have symptoms is due to your immune reaction to the Lyme, not to the germs themselves, but the reaction to the germs, all right? So your white blood cells, when they see Lyme germs or Bartonella or any of the infections, manufacture a bunch of chemicals called cytokines. Cytokines are good and bad. On the good side, they turn the immune system on, but if the immune system is doing a bad job, it's going to keep trying harder and harder, and it's going to make too many cytokines, all right? So symptoms of too many cytokines are brain fog, difficulty thinking, fatigue, sleep disturbances, hurting all over, you name it. All those symptoms we call Lyme symptoms are symptoms that indicate too many cytokines, all right? Now, if you get too many yeast growing in your intestines, guess what they trigger? Too many cytokines, all right? So it produces a situation that looks exactly like your Lyme disease symptom. So often what I'll do in those situations, I'll treat for yeast and I'll treat for 1 or 2 months. And about 80 to 90% of the time, people get back to normal again, all right? So find a provider that can help you look at whether you might have too many yeast and is willing to treat you for it, okay? Because if you do, it could be as simple as clearing your yeast out. You'll be back on your way. There are times when somebody comes to see me and they don't even have any symptoms suggesting too many yeast other than they're doing badly, that I have treated for too many yeast and they've gotten well, all right? So it can be a significant situation that creates a situation that looks like your Lyme has relapsed, but it really isn't, okay? So let me go back. I'm going to show you again. I showed everyone earlier tonight, but I'm going to show you my article on how you can figure out if you might have too many yeast. A lot of it's just based on symptoms. So take a look at my section on yeast and use this article here, which has a lot of information about how you can figure out if it's too many yeast. And if you do, look at this article over here. It tells you how to treat it, okay? I give you an 80 to 90% chance it's not a Lyme relapse, actually. All right. The other thing I would tell you is if it is a Lyme relapse, often you can turn back around within about 4 to 6 months, okay? It's not going back into most of the time, it is not going back into the multi-year treatment hole all over again too, okay? All right. Good luck to you, Wayne. Hello, Karen. Let's see. Hello, Dr. Ross. Lyme has destroyed my knees and feet due to Lyme arthritis. My legs and feet are numb and the burning neuropathy is horrid. I have trouble moving my toes and my toes look white from a lack of circulation. I am worried about my feet and I'm trying Qigong for blood flow. What else could I do to save my feet? All right, so there is a condition in Lyme disease, actually in chronic infections in general, which is known as Raynaud's phenomenon. And in Raynaud's, you wind up getting into a situation where the blood vessels in your hands and in your feet go into spasm very easily. And that spasm of your blood vessels can lead to your tissues turning either white or blue, and sometimes can be so extreme it actually can cut off circulation and kill parts of the digits as well too. All right. I'm wondering briefly, just by what you've said here, and again, I don't get the advantage of looking at your feet, and I don't get the advantage of asking you tons of questions to help clarify it. But just based on the fact you've got a lot of pain and you've got white extremities, I'm wondering, do you have a possibility of having some Raynaud's with this as well too? All right, so what can you do for Raynaud's? Well, herbally, one of the things that can help is to use, that I have found helpful, is to use ginkgo biloba. Ginkgo is, you may be familiar with ginkgo. We use it sometimes for people with dementia. But what it does is it helps your blood flow into really thin blood vessels easier, okay? And so it's an 80 milligram pill, and you do one pill twice a day. That's one option, all right? The prescription medicine option is to try to use what are known as calcium channel blockers, which is a family of medicines that we use to treat high blood pressure. And it relaxes the blood vessels. You can find a dose to use these that does not drop your blood pressure, but will help to prevent your blood vessels from going into spasm. One of those could be to use something called Norvasc. There's another one called Procardia, which is also known as nifedipine. Those are some things that you might consider using as well too, okay? All right. And the other thing is to try to prevent getting temperature changes. Protect your digits from temperature changes, because there's temperature changes of either hot or cold that can cause those blood vessels to go into spasm, okay? All right. Talk it over with your doctors, though, and see if they think that you might have Raynaud's. And if you do, these are some things that you could use to take care of it, okay? All right. Good luck, Karen. Hello, Gail. Let's see. Hi, Dr. Ross. Are you hearing much about the antibiotic azacitidine that Lyme researchers at Stanford found eliminated Lyme bacteria in mice? Last information I can get online is from March 2020, where it says that scientific researchers have patented the compound for the treatment of Lyme disease and are working with a company to develop an oral form of the drug. Researchers plan to conduct a clinical trial. They believe it might be able to clear early Lyme infection without significant side effects and perhaps later infection as well. Okay, so Gail, yes, I am familiar with the azacitidine, but there's no manufacturers yet. And the last information I have is the same information you have, okay? Now, I want to say one thing about it. So everyone, the same lab that discovered that disulfiram can help treat persister forms of Lyme has done further research, and they've discovered that this other drug called azacitidine, which is a type of penicillin, can kill persister as well as growing forms of Lyme, all right? Keep in mind that disulfiram research they did only looked at persisters. We don't know whether disulfiram is good at growing forms of Lyme. So what am I saying by growing in persisters? Well, we now know that Lyme germ has a growing state and a hibernating state, okay? And so we were thinking that the one reason people may not be getting better is that these germs that are in hibernation, the typical antibiotics we use for them, like penicillins and everything else, don't typically work on these. Okay, all right. But so there's labs researching how do we get at the persisters, and the Stanford University lab, Dr. Rahadis's lab, discovered that azacitidine, in addition to disulfiram, can get at the persisters, but his lab also showed that azacitidine can also treat growing Lyme as well too. So it looks promising, all right. He's gone one step further, and they did mouse studies that showed that it had good benefit in mice. I want to caution you, though. We have no clue as to whether it's going to work in humans. We don't. And I'll share with you a story from a few years ago. There's another lab out at Johns Hopkins University that is run by a physician named Ying Zhang. And Ying has been doing quite a bit of work. Dr. Zhang has been doing quite a bit of work looking at what to do for persisters too. And he discovered in his lab in Petri dish experiments that using a combination of cefotaxime, what was the other one? Ceftriaxone, daptomycin, and doxycycline in triple regimen would get rid of persister and I believe in growing Lyme as well too. He tried it out in mice and it did great stuff. We all thought this was going to be the thing that was going to save the world. And then we started trying to do it in our living patients and found no beneficial results, okay? So just because it's been shown to be effective in the lab and in mice does not mean it will work in a human. We are not mice, okay? So, so there have been no studies done in humans, and we haven't been able to try it out in humans because no one's manufacturing it at this point. So I don't know where they are in terms of whether they're going to be able to put together a manufacturing system or not. I know they were looking to do it though, okay? All right. Thanks for that question, Gail, and I'm good luck to you. Hello, Geraldine. Let's see, if you're taking supplements, et cetera, to fight inflammation, would this make response to COVID vaccine weaker as an immune system has to react? That's a really good question, and the answer is I don't know. Because you are right. I mean, in theory, it might be better not to do the anti-cytokine agents at least a week before you get your COVID vaccine, in theory, okay? But the reality is I don't know if it will make a difference. So when you get the COVID vaccine, basically your the current COVID vaccines cause your cells to start producing the spike protein that is found on the COVID virus. And then your immune system sees that spike protein and develops antibodies and has a reaction. Part of that reaction, that immune reaction you get, we need cytokines to trigger that immune reaction. So there is a concern if you blunt down that cytokine reaction too much, that it might make it so you don't get as much of a immune reaction. The reality is it may not matter though. You may still get enough of an immune reaction, but I don't know. As a precaution, you could argue about trying to stop some of your anti-cytokine agents before you go get the vaccine done. You could make that argument, okay? All right. Thanks for that question, Darlene. Hi, Andrea. See, can I do telephone visits? I'm from Ontario, Canada. So I do telemedicine visits, which means video visits. And yes, I have people from Canada that I'm able to help that way as well, too. Okay. In terms of how I prescribe for my Canadian patients, I work with a pharmacy up in Vancouver called Cripps Pharmacy that has a physician on staff that rewrites my prescriptions, and then they get shipped across Canada, basically. Okay. All right. Good luck to you, Andrea. Hello, Heather. Let's see. Hi, Dr. Ross. How do you determine someone has chronic mono? My EBV IgM is normal, but my IgG and early antigen are in the hundreds. Every time that this is checked, the numbers get higher, but I'm told it doesn't matter because it's a past infection. It's a tricky issue. So Epstein-Barr virus is common in healthy people. If I were to go out and survey and pull 100 healthy people off the street and I were to do antibody testing, I would find about 10 to 20% of those people have elevated antibodies against either Epstein-Barr, cytomegalovirus, HHV6, Mycoplasma pneumoniae, and chlamydia pneumoniae. Those last two are bacteria. All right, these germs are common in healthy people. And so just finding elevated antibodies does not mean they're causing you a problem. All right. Our immune systems are designed to cohabitate with germs. Just like we live with bacteria and germs in our skin, we actually live with a whole group of infections inside of us too, and our immune systems do what they're supposed to do. They keep them under control. So a lot of my colleagues will basically do testing and look for antibodies against these common infections. And if they find elevated antibodies, they think they got a treat for it. The trouble is elevated antibodies may mean your immune system is doing a great job keeping the germs under control. It may not mean that the infections have gotten out of control. All right. So to help look at that a little bit more, what I like to do is to do testing with a blood test called a nagalase. Nagalase is an enzyme that is found in the covering of various viruses. And if it's elevated, it can suggest an increased virus load in your body, therefore suggesting your immune system no longer is keeping chronic virus infections like the Epstein-Barr virus in check. Now, I got to admit, elevated nagalase is not specific for Epstein-Barr. What it says is that you've got elevated viruses in general, okay? But if it is elevated, those are the times I will start doing things for chronic viruses, okay? All right, let me show you, you do a screen share so you can read more about this. All right, so take a look at my, let's see here. Let's look at my section on test. All right, so there's an article here called When and How to Treat Chronic Viruses in Lyme. And it's where I address the issue of testing and the nagalase test I mentioned here, and then what to do if you decide to treat it too, okay? All right, Heather, thank you for that question and good luck to you. Hello, Tomas. Let's see. Hello, Dr. Ross. I'm treating Bartonella with clarithromycin and rifampin. I'm trying to add methylene blue, but I can only take half the daily dose, maybe 2 to 3 times per week due to herx causing severe pain. I get the same issue with tinidazole. Do you see this often in your practice? Thank you. Most people that I'm using the methylene blue with are tolerating it fine. I have had some, though, that we have to go lower with the dose. And I can't explain why some people are more sensitive to it with the Herxheimer reactions than others, other than to say I have seen it happen. And we are dosing it. The way I'm using it is to dose less frequently and at a lower strength as well, too. Okay? All right. Thanks for that question. Hello, Margaret. See, good evening. Thank you for all you do to educate with Lyme disease. You're welcome. I have begun second bottle of yeast cleanse. I find I am not as disciplined as being strict with no sweets, etc. I usually am able to be very on target, but this is not so easy. I'm taking two times a day. Any thoughts to how to get more strict to not give into any urges of carbs, sweets, etc.? All right. So first of all, let's talk about the kind of carbs you should avoid. So you should avoid cookie, candy, cake, ice cream. Okay, those are the big ones I would avoid. I am okay with my patients having fruits and vegetables. All right. And that's because those fruits and vegetables, so long as they're whole fruits and vegetables, have fiber attached, and that fiber limits your the availability of sugar reaching the mold or the yeast. Okay. In addition, I am okay with people being on beans, legumes, and grains because, again, there's fiber attached, which limits the availability of the carbs in those from getting to the yeast. Okay. I am not okay with fruit juices and vegetable juices because the fiber in those have been stripped out and all that's left is the sugar. All right. So if you could be more disciplined by just avoiding cookie, candy, cake, ice cream, and fruit and vegetable juices, that might make it easier for you. All right. Now I don't get to ask you tons of questions here about what you mean by sweets, but those are some things to keep in mind. Okay. All right. Thanks for that question, Margaret. Hello, Sharon. Let's see. In 2019, IGM positive IGenics. I think I already answered this one earlier. I did. All right. Hello, Derica. Let's see. Hi, my son has been on antibiotics for almost 2 years trying to treat Babesia, Decani, Bartonella, Henselae, Rocky Mountain spotted fever, Rickettsia, Borrelia. We tried to stop treatment and Babesia grew to much more positive. Does it mean it's active infection if the titer grows after treatment? And we resumed treatment again and hope so much. Let's see, last part, I think. We hope to get rid of at least one infection. So far, only plasma became negative. All right. So the only way that the titers mean anything is if he also is having symptoms. So once you've tested positive for these infections, titers are going to go up and down, irrespective of whether the germs are active or not. So you need to also look at the symptoms. So if your son's titers for Babesia are going up, but none of his symptoms of Babesia are getting active, you don't necessarily need to treat it. In fact, there is not a useful way of testing to see where you are in Lyme treatment. I know a lot of my colleagues are doing it. They're wasting your money. We have no accurate markers that tell us if we're getting better or getting worse by just looking at the test after an initial test, okay? So those are my thoughts for you on that. In fact, I've got an article about that. Let me just do a quick screen share here for you. Let's see. Let's see. Repeat. I think I got an article called Repeat Testing. Yeah. So here's my article, which says repeat Lyme and co-infection testing to check treatment status is not valid. Okay. I even have a whole article about it. So take a look at it here for further information about that. Okay. All right. Listen, everyone, that's it. It's time to go home. I'm having a dinner with my girlfriend tonight, celebrating our 1 year of knowing each other, but it's a socially distanced dinner. So I'm going to be doing a Skype prepared meal this evening. But anyhow, so I've got to get home for that. And yeah, that's it. Oh, so tomorrow morning, keep your look out at your email. And in your email, you get some information that'll have a link to sign up for next week's webinar, but also you'll find information about how to see the video recording of tonight's webinar as well too. Okay, had a good time being here with you everyone tonight. If you do find benefit from these, please share the video recording links tomorrow with as many people as you think might get benefit too. And also share information about, when I send out information about how to sign up for these webinars, spread that around as far as you can as well too. Help me to reach as many people as possible with the information we have here, okay? All right. Good night, everyone.